You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to this week's episode of the RN Mentor podcast. I am being joined by Dr. Wallina Gould. She is the founder of the nonprofit organization Diversity in Nurse Anesthesia Mentorship Program, former chief nurse anesthetist. For 15 years, this grassroots organization program has successfully mentored over 577 diverse critical care nurses into 82 graduate nurse anesthesia programs. Dr. Gould was the lead consultant for a $1 million HRSA Workforce Diversity Grant for the University of Tennessee at Chattanooga Nurse Anesthesia Program and was the AANA Chair of the Diversity Task Force from 2015 to 2016. In 2015, Dr. Gould was inducted as a fellow of the American Academy of Nursing. Dr. Gould was the first CRNA of color inducted as a member in 2018. She was the recipient of the Trailblazer Award from the National Black Nurses Association. In 2019, Dr. Gould serves as a member of the American Academy of Nursing Diversity and Inclusivity Committee. Most notably, Dr. Gould was the recipient of the 2019 American Association of Nurse Anesthetists Agatha Hodgins Award for Outstanding Achievement. Welcome to the show, Dr. Gould.
Yeah, thank you so much. I appreciate you inviting me for this podcast. I really do. Thank you.
Well, we had a brief conversation before we got started, but like I said to you before, you are sort of the essence of what this show is about. So thank you for all the work that you're doing. But before we get into your incredible work, I want to start with what I always start with my guests off of is, how did you get started in the world of nursing, and how did your career path kind of transition you to where you are today?
Well, my transition started in undergrad, obviously, but it wasn't. I wanted to go to nursing in undergrad, but I couldn't. I was a single mother on welfare. I was homeless 3 months right before I started school.
Oh,
So I
wow.
ended up getting an apartment. But the problem was there was a barrier when it came to nurses, especially nurses that came from my type of background, where you needed to have your own transportation to get to clinical sites. And a lot of the clinical sites were out of county. And there was no way for myself to get there on time, especially to get my son to a daycare and then go off to, clinical. So what I did instead was that I ended up majoring in business, which was an accounting major. And um, I had secured a internship in New York City in my junior year during that summer for Ernst and Whinney. It's an accounting firm, an international accounting firm. And then they ended up hiring me after I graduated from Fairleigh Dickinson University Nurse Anesthesia. Fairleigh Dickinson University, and then I worked as an auditor for a year. After that, I got married. Then 3 months later, after that, then I went back to school for nursing because that is where my passion was. That is what I always wanted to do, and I just felt like the corporate culture was not for me.
Oh, wow. So did you go through a traditional program, or was there a bridge program, or?
No, so instead, I did not go to a BSN program. I went through an ADN program.
Oh, okay. I
ADN
see.
program. So, and that was it was much easier for me to do. I just didn't feel the need to have two bachelor's degree for nursing, especially when both programs were essentially taking the same test to become RNs. So I did that, and I did well in it, very well in nursing school. But my first position was in a operating room nurse. That's how I found out about nurse anesthesia. It was certainly not in nursing school, because the faculty, we had all white faculty. I don't remember or recall any of them talking about advanced practice nurses roles, and especially nurse anesthesia. So I didn't find out about nurse anesthesia until my first position.
Yeah, that's it's interesting you mentioned that. Actually, I had a student who just reached out to me. She's an ADN to BSN student. She's doing a transition program, and she mentioned that she's interested in as a CR to be a CRNA, but she wasn't able to find anybody to find out more about the program. And I happen to have a couple of people that reached out to, haven't heard back from them yet. But I also mentioned, I'm like, hey, I have somebody coming on a podcast, so hopefully she'll get some information. And the reason I bring that up, that undergraduate, whether ADN or even BSN, I don't think we talk about advanced practice enough, and they're just simply not exposed to it. The students are just not exposed to it.
They're not exposed to it, but it's interesting that you brought up about the transitioning, because I worked in the OR. I was a nurse for 8 years before I went into nurse anesthesia. So the transitioning for me was finding about nurse anesthesia in as an OR nurse. Then worked a couple of years. Then I went into telemetry. I worked there for a year, year and a half. Then I went to trauma, right? But the thing is about transitioning, and the reason I still didn't have to go back for my BSN, because that's what you need. You need your bachelor's degree in order to get into a nurse anesthesia program. It just so happened I live in South Jersey, in Philadelphia, there was one program out of six that offered what do you call it, a bridge program. So that was for someone that had their bachelor's in another discipline, their associate degree in nursing, and then they can go right directly into and at that time it was 2002. I was enrolled in a program. I was bridged right into the master's degree program. So I did not have to have I don't have my BSN.
Yeah, yeah, yeah. And that's actually, that BSN component is, I hate to say it, but it's sometimes the way we have written policies that BSN becomes a barrier for so many people moving into, like, I know so many people that have like a bachelor's degree in another field, have an ADN, but they're almost forced to do a BSN to get into or get access to a certification or an MSN program or one of those things.
Right, right, right. And I believe at that time there was 100 schools. Right now there's 124. But I think they were one of maybe two or three other programs in the country that actually had a bridge program. I'm not sure if they're offering that anymore at this time, but that was the only way I got in, because I just refused to get another bachelor's degree.
It makes
So,
sense. It makes sense. I
right,
would hate to repeat something over and over again.
right, right,
So, talk to me if you can talk to me about your process of not only getting exposed to the CRNA role, but what was your sort of like your methodology in saying this is how did you find out what you need to do to get into a program? I know you mentioned you started out in the OR, but
right.
how did you
Well,
make yourself qualified, that you met the requirements and you were prepped in going into that program?
well, there's two ways I can answer that. The one was what piqued my interest was not it was the provider at the head of the bed that was given anesthesia. And again, I didn't know about that. I didn't know nurses can do that, right? So I'm looking at that as I'm a scrub nurse and a circulating nurse too. And I'm looking at this, but also at the clinical site in Philadelphia, it was a level 1 trauma center. There was a black chief CRNA who was
Mm,
there. And when I looked at her, I seen a mirror image of myself. And I said, I want to be like her one day.
that's
One
awesome.
day. So I knew by, every day being in the OR, whether I was in a room doing GYN surgery, orthopedics, hearts, any type of surgery, I was always with a nurse anesthetist all the time. So I would always had an opportunity to speak with them. and they told me about what I needed to do. First of all, I had to get out of the operating room because that skill set was totally different from what is expected in order to go into nurse anesthesia. But I also knew that I lost a lot of my skills too, being in the OR as an OR nurse. So that's why I had to go from OR to telemetry to get the foundational skills that I lost. And then I went into trauma. And at that point, that's when I knew I can apply right, to a nurse anesthesia program. And it just happened to be LaSalle University in Philadelphia.
Oh, wow, that's great. But you it's good to have that access to people that can actually walk you through the process of what you need. Um, did anybody? What was well, not that anybody. What was your transition? How supportive was the organization that you were with to transition from an OR position into like a telemetry? Because in ORs, you mentioned some foundational skill sets that may have been lost. What were those foundational skill sets that you had to brush up on?
Well, the thing is that I mean, I was not, I didn't have the opportunity to place IVs, to titrate drugs,
Mm.
to assess patients. So it's a different skill set for the OR nurse that have to work, obviously in the OR to make sure that, the cases are running smoothly, to make sure that the OR tech has their, their equipment and things like that. That's a different skill set altogether, right? So, but I know that I knew going in that it was going to be difficult for me to go right into the ICU from the OR. So
I
I
see.
had so I had to get some sort of foundational skill set before I went into a critical care department. So what I did was I decided I was going to do telemetry first. Did that for a year at another level one trauma center, and then that's when I transitioned to trauma. So I needed that. I needed that experience. Yes, was it lengthy? Yes, it was very lengthy, and that's one of the reasons why I do what I do now because I took a very I my journey was rather long, so I'd rather tell or share or mentor nurses and say this is exactly what you need to do in order to go into nurse anesthesia. So their journey, they don't have to do this alone at all.
Right, right, and it makes sense so that a lot of times when students talk to me, or from my own life lessons, I'm like, it's probably depending on what's on your plate. It's sometimes easier to break it step by step, right? Like for you, I'm sure you would have been successful going straight into the ICU, but it may have been more to take on. So it makes sense to, let me build some foundational stuff in a tele. Then that way you don't have to worry about it when you go to the ICU. Kind of the same advice I give my students who want to go straight into an ER or straight into a critical care unit. I would say, yes, definitely doable. You just have to take on more because you have to learn some of your foundational stuff in the hospital. At the same time, you're trying to learn all the advanced care and critical care stuff that you have to learn on top of that. So something as simple as time management may become problematic because you haven't had that transition time. So yeah, I never nursing being my second sort of career. I never look at people's trajectory of how long it took them to get somewhere, right? So it makes sense. It makes sense. Um, so talk to me. What was your process of you applied to a nurse anesthesia program? Talk to me a little bit about the program that you went to, and then I want to start getting into how you got into the world that you are working in now.
Well, that what happened to me in nurse anesthesia, in the nurse anesthesia program is basically it laid the foundation of where what I needed to do in order to advance diversity in nurse anesthesia period, right? So it all started as a poster project. That's all it was. And the assignment was for each of the nurse anesthesia students in my cohort, that we could do anything anesthesia related. But the thing is, in back in 2002, what they had, it was called a shared curriculum. So they no longer do this, but it's a shared curriculum. It was with LaSalle University, Penn, We did it with Villanova, Drexel University. So we would go to each other's programs, and we would have a faculty instructor, nurse anesthesia faculty instructor, teach all the content. So
Mm.
what I noticed being in these big, large classrooms with all these different cohorts from all these different programs, you can actually see who the nurse anesthesia students are in the school, and they didn't look like me,
Oh.
right? So, and also the nurse anesthesia faculty were all white
Mm.
at all these different nurse anesthesia programs. So when we had the assignment, I wanted to know what the racial and ethnic composition was for the profession. So my poster project was called Diversity in Nurse Anesthesia. And so what I did was I polled the nurse anesthesia students from each of the programs, because I wanted to know what their background was as far as the race being, racial ethnic background, and also I wanted to know what the national numbers were too. So I didn't know how to go about doing that. So my program director told me to contact the AANA, the American Association of Nurse Anesthetists. I just made a simple phone call to the Chicago office, and they actually sent me the data. And at that time, it was 37,000 CRNAs. Right now, it's 57,000. But at that time, it's 37,000 CRNAs. And it was less, it was just a little bit above 1% of black CRNAs. But on my poster, and I have it hung up in my office,
I
but
still have it.
right, yeah, I still have it. So
That's awesome.
the graph mirrored the national graph mirrored the graph in Philadelphia of all the nurse anesthesia programs,
Okay.
meaning all of it was severely underrepresented. Okay, and the thing is that I did receive an A for it, but I there was something wrong, and I went to one of the program director at Penn who was teaching regional anesthesia, Dr. Arthur Swirling, who was ended up being a mentor to me. He was one of my first CRNA mentors, and I told him about my project, and he said, Lena, he said, that's interesting. He said, I want you to go to the AANA annual meeting in Boston. I've never been to a meeting before. Here I am, a student. And he said, because no one else is doing this. And I didn't know what doing this was, right? So, and I didn't know a soul, right? So the first day when I went there, and obviously most of the nurse anesthesia students didn't stay at the main hotel with all the CRNAs. We stayed at hotels like 10 blocks away. We would go there. But that first day, this is how everything changed for me. All I remember was walking in the main lobby of the hotel, and I seen this elderly black woman who was sitting in a chair, and her cane was right next to it. But there was a long line of CRNAs, nurse anesthesia students, to shake her hand, and I didn't know who that was. So I did ask somebody, and they said, "Oh, that's Goldie Bragman." I said, "Who's Goldie Bragman?" And she said, "Oh, that Goldie Bragman was the first and only black CRNA who was the AANA president." And she
Oh,
was
wow.
also the program director at Harlem School of Anesthesia. Now, mind you, I already had classes at all around Philadelphia, going to all these different. Not one CRNA mentioned her name,
Wow.
so I didn't even know about her. So I ended up getting on that long line, and I ended up meeting her, and I shook her hand, and I knew then at that point that I had a purpose, because for some reason, after that, she became my second mentor. So
Fantastic.
she had a very historical role anyway with Dr. King, when he was first assassinated in New York, and she was the nurse anesthetist for him too. So
Oh, wow.
so that conversation with Dr. Art Swirling at Penn led me to the ANA meeting, led me to Goldie Bragman, who I met and who was a pioneer in nurse anesthesia. But it was at that moment I knew that this was going to be my passion, and this is what I was going to do for the rest of my life.
Wow. That's amazing. Um, so, so when you just because I'm looking at as you're talking to me about this, I brought up your website, which by the way will be on the podcast link. Um, and I'm looking at these numbers. How have what were the number? You shared a couple of numbers with us from before, but I'm looking at the numbers you have on your site right now. Um, and it's 2% out of 57,000 CRNAs. CRNAs of color are making up 12%, and 2% are African American, 3% Hispanic, 3% Asian Pacific Islander, 0.7% Native Indian, 3.8% other or non Caucasian, 87.5% white. I mean, those numbers are no joke. There's a huge disparity as to the people that are able to go into the program or actually seeking to go into the program and the access for those. So how are can we? I just want to kind of jump in with the work that you're doing now. I'm excited to talk about that. Uh, the work that you're doing now in bringing or exposing and helping uh, future CRNAs with of color get into the program and kind of diversify this field. Um, Tell us about this program and what you've actually accomplished. I know it, but I want everybody else to hear it from you.
Right. Well, I just want to go back from 2002 with the 37,000 CRNAs. The aggregate number was 6%. Now,
Oh wow!
today, the aggregate number is 12%. And I do believe that what I'm doing and what I have done for the 15, 16 years have contributed to that number, right? Significantly. But the thing is that since that time I did that poster project, I had mentored nurses, and it was all word of mouth. Mind you, there was no website, there was no social media. Um, for some reason, nurses in Philadelphia area found out that I was giving out information about how to prepare yourself for the nurse anesthesia program, what the rigors were, what the clinical expectations were, how to balance family and finances and all of that. And when I graduated, that information grew from nurses going from Philadelphia to New York. So one thing that what I did was I asked Betty Walgus at the time, she was the program director at Villanova. Now here I am, 1 year, 2 years out of as being a CRNA, still giving out all this information, mostly from my home. But the thing is, I said, Betty, I said, I need space. I need more space. I
Yeah,
said, nurses are contacting me, and I really like to have, I like to share this more in a more formal gathering. So she at Villanova at one of the hospitals that they are affiliated with at Chester Medical Center. She would allowed us to use a very big, large auditorium. So I put the word out that that we were going to have this event, and then next thing you know, we had nurses from Philadelphia, New York, Baltimore, and DC
wow.
that came to the event, and it was all newly credentialed CRNAs at that time giving out information. And we had an experienced CRNA there too, but we would just talk to them again about the admission process, how to prepare for the mock interviews, how to balance family and finances, clinical expectations, things that they should know before they even go into the school. Because for many of them, like myself, I'm first generation, so a lot of them do not know, right? So from that time of just using that space, and really that first 5 years, that was the most difficult time because a lot of people were not feeling diversity. They weren't talking about diversity. They weren't embracing diversity. So, it was, I received a lot of pushback, during that time. But I just kept going and I just kept, it just got bigger and bigger. It went from a regional effort to now a national um, organization. So now I have like three different diversity pipeline efforts. The first one is the RNs, critical care nurses who are interested in nurse anesthesia, but before they apply, they come to our event. And it's a weekend event. Before COVID, it was a weekend event. And on a Saturday, they will find out information about the program specifically by four different nurse anesthesia program directors. Then there would be CRNAs that would make some CRNAs of color that would make some sort of presentation, anesthesia related. And then also at the end, there were nurse anesthesia students. And nurse anesthesia students from different programs would talk about their different experiences because some of them were military, and how do you get into nurse anesthesia being in the military? So we need to talk about that. Some of them have children, and we need to talk about that. So these are especially of nurses of color. This is on the back of our minds of like, how are we going to actually do this? How are we going to go from working as an RN and then not working for 2 to 3 years? How do you possibly do that? So we do that, and then that second day is simulation. So we'll use the simulation of the nurse anesthesia program, and we'll have, now we average between 130 to 150, because it's a capacity issue. We can't go over above that. Um, so we have done that, and that's where that number contributes. So now, um, when they go to that event, they have also networked with other CRNAs too across the country. They network with nurse anesthesia students from different programs from across the country, quite possibly even trying to apply to the program that they went to, right? So now the networking has increased too. So before they even apply to the program, they'll have opportunity to have their personal statements read and critiqued by myself or 14 other CRNAs. We have group mock interviews throughout the year, so we'll do that too.
Wow.
I'll introduce them to someone if they're interested in, say, Duke University Nurse Anesthesia Program or University of Miami or Georgetown. If they're interviewed, they scheduled interviewed, I would introduce them to somebody that's currently enrolled or someone that graduated from that program. So now they have someone from that particular school that they can actually talk to. So and that's how you basically, diversity is all about just relationship building, and that's all it is. That's all it is relationship building and access, right? So, and with that second initiative, we go to we have diversity CRNA HBCUs, School of Nursing tour, and we also go to the Hispanic Serving Institution Schools of Nursing, and it's myself and maybe 12 other CRNAs. We have our own anesthesia equipment, and we'll talk to schools, the nursing students. Again, many of them are first generation, and they don't know about nurse anesthesia. Some of them may be interested, some of them may not be interested, but at least they have that exposure.
Right.
At least they have that exposure. That's all you can do, you know. And then our third diversity initiative is Diversity Advanced Doctorate Symposium. So I usually have a combination of CRNAs, nurse practitioners, um, nurse midwives of color who have their doctorates, either PhD, EdD, DNP, and we all talk about our different trajectories. And at the very end, I have fellows of the American Academy um, of, of color who will also speak about how they should build their resume, how to build their research, so that they too can become members of the academy.
Oh,
So,
wow.
so I have a pipeline opportunity for nurses of color or nursing students that are trying to come in, because for many of them, like I said, they don't, a lot of them are first generation college graduates. A lot of them do not have a mentor that they can trust and say, I'm going to take this information and now I'm just run with it.
Yeah.
It's up to
Yeah.
them after that point if they're actually gonna follow through. We just give the information.
Yeah. That sounds amazing. I mean, it just feels like you have almost I want to say you have an in into wherever you want to achieve, right? Like you have the information available to them, and it's just a matter of opening the door and stepping in and doing the work. So that's fantastic. Now, I had as you're talking, I've been jotting stuff down. You mentioned something that clicked with me is the fact that you have individuals that are representative of the community that you're trying to build. I happened to be sitting in a meeting a while back, and it's something I mentioned. I said, the question was, how do we increase the number? How do we increase diversity among faculty? And one of the things I mentioned is like we need to hire and not just faculty, and and also how do we diversify the community of students? We have a very diverse community already, but how do we like stir it up a little bit more so there's more diversity, or increasing some of the populations that we don't necessarily see because we for various reasons. And I said we need to hire faculty that look like the communities that we serve. So I think that's key. And you mentioned something like that. How important do you think for those individuals to see somebody and a CRNA of color speak to them versus somebody else?
Well, how can I put it? So in just being a student in a nurse anesthesia program, you can go through the entire program and not have a faculty of color.
Right,
And sometimes, and these are in major urban cities. That makes no sense,
right,
especially if you have graduates that came from that particular program. That's telling me they're not even tapping on the shoulder of that person that graduated. You know,
right,
that's a problem, and it's not just hiring nurse anesthesia faculty. It's also hiring when you go to these clinical sites for your nurse anesthesia experience, whether it's pediatric anesthesia,
right,
cardiac anesthesia, whatever, you still have to have a clinical coordinator, a CRNA clinical coordinator. And most of the time, the clinical CRNA coordinators are white.
mm,
So it's faculty and it's clinical coordinators too. But the thing is that that's an institutional problem where they have to be intentional
right,
as far as hiring. They absolutely have to be intentional as far as hiring someone of color. Now, the thing is that sometimes, and they do, they interview, nurse anesthesia faculty. I mean, nurse anesthetists will interview for faculty positions, but sometimes they're told they don't have teaching experience. So what do you do?
that's it's
You know
it's
what I
the
mean?
same issue with like job. Oh, you don't have job experience, but
Right, right,
like they gonna everybody
right.
has to start somewhere.
Right, right. So the thing is that, but I do know that there are white CRNAs who have been, who went directly into faculty positions right
Oh
out of
well,
school.
yeah,
So it's not like, I mean, I just don't understand what's going on. But the thing is that again, they just have to be intentional, with the hiring efforts because that's, I mean, embracing diversity from your website, the statement is one thing, but actually seeing your faculty, that's
right,
totally different. That
right,
means that you that are engaged in the process of making sure that happens, not just with the faculty, but also with your student cohort. You know,
right, right,
but sometimes even that too, you got barriers such as GREs and things like that
yeah,
that can hamper admissions as well. So, but yeah, it has to be an intentional effort, something that's that, and sometimes it falls in with the dean. It falls with the dean.
yeah.
I really do think that should go on the shoulders of that dean to make sure that it actually happens, because we're out there. It's just it's is the school committed to do that?
Like I'm 100% on board with what you're saying. How much do you think? Because I think having a diverse faculty is an issue across the U.S. in any program. I think we have that issue. How much do you think pay gaps between what nurses make on the outside versus what they make in an academic institution play a factor in getting more diversity?
Well, I know that in schools of nursing, the the faculty's salaries is usually higher than nursing faculty. That's in order to attract CRNAs. You have to do that. I know that also too that faculty, nurse anesthesia faculty, also work maybe one day a week giving anesthesia. So that's even additional income that they can have just to keep their skills up. Um, but like I said, it has a lot to do with making sure that the CRNAs, or diverse CRNA applicants are coming through, for faculty positions. I mean, just to show you just the acuity of the problem, just to demonstrate that in the Northeast area, because that's where I live at, in the states of Pennsylvania, New York, New Jersey, Connecticut, Maine. Um, in those states alone, I think there's maybe 35 nurse anesthesia programs. There's only one full-time black full-time faculty member in
Wow,
Pennsylvania, and that's it.
wow,
That's it, and that's Northeast. Now, certain regions of the country, you will have other. Like in Florida, you may have more faculty of color. There's only two in Georgia. So it's just, you can just count on your hand at this point, and it's rather sad. But again, I think it's time that nurse anesthesia programs step up and just go ahead with the next hiring process to make sure that applicant is going to at least be interviewed, and get the
Right.
and get the and get the opportunity to teach in their programs.
And I think part of what you're saying, and correct me if I'm wrong, is programs just need to do a little. They need to do a better job searching um, for faculty. So so you have a diversity in applicants. So when you choose, you have qualified candidates that you've actively reached out to. Sometimes it feels like programs just kind of put an announcement out there for an opening of faculty, and whoever comes through the door is who they may actually hire from, and not do any of the, maybe perhaps a little bit of more legwork to get a bit more diversity in their applicants, qualified applicants.
Well, the thing is, sometimes too, and this is certainly true for nurse anesthesia, you may have a particular person that you're friends with that you want to apply.
All right, right. Well, I mean, that's where networking. That's what networking comes into play a lot of times. And that's what I always push. I'm like, you may be the most qualified person, but networking, and I think that's where your program is so valuable, because you actually actively, proactively um, have opportunities made available to your to the cohort, so they are actively networking with each other and with their faculty. And
Yeah, absolutely, absolutely.
yeah, so that's extremely important. We have a lot of work to do, just overall, with how we. There was something on a program. I won't mention them. I don't know what copyrights and stuff are, but they were talking about how the joint. I think they were talking about the Joint Chiefs of Staff, and how during the Obama administration they had diversity, and then now you look at the Joint Chief of Staff, kind of uh, you look at them and they're all white again. One of the things that they were mentioning is people have a tendency to hire people that look like them, because that's who they, for whatever reason, relate to, instead of looking at but I think that needs to be purposeful of how we recruit and how we diversify the applicants. I think that takes a conscious effort that maybe people aren't putting in. So I agree
Yeah,
with
and
you.
yeah, and also what's the composition like for the committee, the one that's on the hiring committee? Somebody's got to speak
Yeah,
up.
yeah. Yeah,
Somebody's
yeah,
got to
yeah,
say something,
definitely,
Yeah,
definitely.
yeah.
Yeah, I'm 100% on board. Um, so I want to talk to you. So I see you. You're I want to call you're almost like, I want to say, a Twitter cheerleader with the CRNAs. I see you post all the time, and elevate, right? Elevate the CRNAs that are coming through, and getting jobs, getting into programs, all that stuff. Talk to me about a little bit of your presence in social media, and um, that component.
Yeah, so I believe it maybe was 2008 when I started to involved in social media, especially it was Facebook first, then it was Twitter, and then it was Instagram. Now it's funny, with Twitter, I have I how can I put it? I see more. I'm more engaged with the academia um, people. Like
Yeah,
those that are faculty, that are deans, that are researchers. Whereas on Instagram, I have a much bigger following, maybe like 15,000, almost 16,000 followers. But those are the nurses and the nursing students, primarily of color, who are interested in either going into nurse anesthesia, or in the process of applying to nurse anesthesia, or that are CRNAs. The engagement is weird. The engagement and the ones that you want to diversify in your program are landed in Instagram land, and the ones that are teaching, or the ones that are responsible of hiring or anything like that, they're in the Twitter world. So for
They're not living.
somehow
They're
they're
not
not.
living in the same same
Right, like right.
same.
So you're talking to. So even though I might tweet something, trust me, I usually expand what I have to say on Facebook and on Instagram, and I get a lot. The analytics is, through the roof when it comes to the Instagram following and the engagement and the shares and things like that. But what I'm most proud of is that when we make the announcement that we're having a diversity CRNA event, especially because of the pandemic, right?
Yeah.
Everything had to be converted to Zoom or online, but we actually had more nurses come to that event because there's not a capacity issue. So
Right.
now we
Right.
got last year we had 4 Zoom events with 200 plus different nurses at each event, but we don't have a capacity issue. But that still tells me that there's somebody needs to do something about this, and I continue to make a path for them, and it's not just about getting into nurse anesthesia. What about when they become CRNAs, right? So some of them I try to urge them to go for the PhDs. Others are becoming chief CRNAs. Some of them are getting into faculty roles now. They're military CRNAs. So right now, it's not just getting them in. It's about what are they going to do after they become CRNAs. And by doing all of that, you're just changing the whole culture of it. A lot of
Yeah.
people that
Yeah.
can't do that. You got to change the culture.
Yeah. That makes sense. Now, as you're mentioning this, and when I don't want to say if, when the world goes back to normal, are you planning on keeping like a sort of a Zoom presence so you can reach out to more, or how are you thinking about that?
Well, I'm thinking about combining the two where I can either, instead of having four maybe face to face events, maybe have two face to face and two online. Because some people may not be able to afford or, can fly out to, like our last face to face event was at Texas Christian University. So somebody from Michigan or California or New York, maybe, and may
Yeah.
may not be able to afford it, and that's fine. But I think what because of the pandemic, things changed and we have to change and adapt as well. And like I said, I mean, as far as a capacity issue, instead of us saying, "I'm sorry, we can't have you come to this event because it's full," with our at least with our online capacity, I mean, capacity is not an issue. So we're gonna
Yeah.
definitely keep both of them. But like I said, I mean, every time we had an event, whether it was face to face or Zoom, we still had, and when I say Zoom, I'm not talking about a 2 hour Zoom, I'm talking about 8 hours of content, and
Yeah.
they
Yeah. It's a
stay
lot.
on. They don't even drop. They
Yeah.
don't even drop. So, you can't have PowerPoint after PowerPoint after PowerPoint. You got to keep it very engaged.
Yeah,
So,
that's a whole feat of itself. So,
right, right, right. Yeah.
uh, so I want to, just because I know there's going to be listeners who are looking to CRNA programs who are probably going to tune in specifically because you're talking. So I want to make sure that we have an opportunity for you to give them any kind of advice if they're looking to get into a CRNA program as whether they're a new nurse or an experienced nurse. What's the path if you were going to have somebody in your, let's say, sitting with you and say, how do I get into a CRNA program? What's some of your pearls of wisdom?
Well, okay. So basically, well, I would give the same information as if they were at a HBCU School of Nursing. We would talk to them in this way and would say, listen, this is the pathway that you need to do, and also we'll give them information too, so they don't have to try to memorize this. But basically, after they finish their nursing, because almost all the programs right now they're converting to the doctorate, so the DNP or the DNAP program. So the thing is that they need the ICU experience. They need at least 1 or 2 years at a minimum. They need to have shadowed a CRNA. They have to do that. They also have to, it depends on the institution where you have to do well on your and pass the GRE exam. But I'm telling you right now, there's a long list of nurse anesthesia programs who are dropping that requirement. And basically by just dropping that requirement, they're even getting more applicants of color going into that program. So it's either, they can apply to one or two programs, and one with the GRE, one without the GRE, is totally up to them. They also need to have a personal statement that needs to be submitted to the nurse anesthesia program, but they got to be very careful when they go to the website of that program. They have to follow directions, right? So if it says 500 word count, don't don't submit 800.
Right.
You know what I mean? If it says, do this in an APA format, do it in an APA format. And also they'll have a opportunity to interview as well, right? But because of COVID, and in the past year, almost all of the interviews have been online, Zoom like type of events. So that's why we also have mock interviews too,
Hmm.
about exactly what to do. We don't tell them what to say, but we'll critique what they're saying and what we don't hear sometimes. So we'll go over that information as well. So that's just the part of just getting in, right? So when they go into the nurse anesthesia program, we'll still continue the mentorship, but we do let them know in advance what that program is like. So it's, you're not working anymore full time. You have to give up your full time job. So that's a huge sacrifice for anybody
Yep.
to go
Yep.
into a
I agree.
program. So that's a huge sacrifice. So you got to take that into consideration, especially if you have kids. If do you have that support system at home? You know, so the thing is that you're going from two incomes to one income sometimes, or one income to no income.
Yeah.
So take that into consideration. Do I want diversity in nurse anesthesia? Absolutely. But I want to make sure financially, if it's better for you to apply next year so you can save up and pay down debt, do that instead.
Yeah. Yeah.
I'm not, yeah, you know what I mean?
I 100% agree. You don't want to be in the middle of a program and realize you can't pay your rent.
That's right.
Yeah,
That's
I
right.
agree.
That's right.
Yeah,
Yeah. So it's all about being, preparation. Just
yeah.
it's 90% preparation.
Now you mentioned something, and I want to touch base on this. There are a lot of institutions that don't allow shadowing. What's the for? And I know mentioned that would be like one of the main things people should do. And I know one like institution in Southern California, which is one of the biggest ones that's out here that doesn't allow shadowing. How do they do that? How do they get over that barrier?
Yes. So each state have a Nurse Anesthesia Association, right? So I live in New Jersey, so there's the New Jersey Association of Nurse Anesthetists. In California, is the California Association of Nurse Anesthetists. In Georgia, same
Right.
thing, right? So typically, what I tell nurses also too is to go on the website of the state where you reside in, or at least the state where you're planning on even applying to the nurse anesthesia program, and on the website. Not all, but many of those websites from the different states, they have shadowing
Oh,
experience where they can connect. Somebody will be responsible of connecting you with someone else at another hospital. So they may not have an opportunity to shadow at the hospital where either you work at or the hospital that you just mentioned, but that's how you connect with other CRNAs
wow,
too,
that's awesome.
right? So yeah, so the California Association of Nurse Anesthetists, there is a section where there's for nurses that are interested in nurse anesthesia. I would suggest that they go on to that as well. So definitely the websites for any nurse interested in anesthesia is number one, make sure that they peruse the website of the nurse anesthesia program that they're applying to. The state Nurse Anesthesia Association, that website as well, plenty of information about nurse anesthesia that's going on in that particular state, and then also the AANA, the American Association of Nurse Anesthetists. But the website, perusing the website of the nurse anesthesia program is very important because they need to see the admission criteria, the clinical sites, the curriculum, and also the faculty profile. They need to know if they're going to be scheduled with an interview, you need to know who that faculty is, what type of research interests they have, what type of teaching interests that they have. There's a lot of homework that the nurse have to do too. So, I can give you that information, but it's up to you to click
Right.
it.
It
You know,
makes
so okay.
that's why I always tell my students, I'm like, I can give you all the information you want, but at some point you're gonna have to do the legwork
That's
for to
right.
do
That's
that. So
right.
yeah, thank you so much. Great information. I want to be cognizant of your time. Anything else you want to share before we sign off?
No, no, no. Again, like I said, I appreciate the time and the invitation that you gave me and afforded me this opportunity to speak about nurse anesthesia and my passion. So thank you so very much. I appreciate it
Thank
again.
you, thank you. I appreciate you being on the show. I might ask you to come back because I want to talk about scope of practice. But I want to do like maybe with bring some NPs also. I want to have maybe a combo show of talk about scope of practice of advanced practice nursing. So hopefully,
That would be wonderful.
we'll have you back and we'll have that discussion. So thank you so much. We have been listening to Dr. Wallina Gould. Um, uh, for like I said, you are sort of the essence of what this show is about, and thank you for all the work that you're doing. So with that said, I want to wish all of our listeners a great rest of their week, and we will see you soon. Have a great one. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.